top 5 aesthetic procedures. Well, it all starts with healthy skin. So the first aesthetic procedure for a healthy appearance has to be the skin. That covers everything that we work on, everything we see, and it's kind of a window to our health. So improving skin health is a big priority, and that is done with a personalized or individualized plan based on the person's skin type, what type of damage they may have had, if they're prone for skin cancer or not. And it's a lot more than sunscreen and moisturizers. New science has shown that healthy and younger skin requires stimulation, requires proper cleansing and exfoliation, and requires protection with antioxidants. There's a lot of new technology that's very exciting that can reduce the things that normally age our skin and keep our skin young for many years. Chemical peeling is one of the most misunderstood areas, and that's also a priority with a good skincare plan because it will remove the oldest, most damaged surface layer, stimulating the body to make new cells, which tends to slow down as we get older. The second procedure that I would say is in the top list would be use of light therapy. The new Cyton laser, particularly with broadband light, has been shown to genetically turn on our genes of youth, so to speak, and restore the cell's ability to function, which happens to go down over time. It can coagulate blood vessels in the skin when people have a condition called rosacea and eliminate those. It can also restore a lot of normal color and texture to the skin. So that's something that's easily done with very little downtime. Laser resurfacing, a little more downtime, but again, restoring the skin is in the top list. The next thing I would say would be using fat grafting. Fat grafting has the ability not only to fill areas of deficiencies in the tissues, but also when combined with platelet-rich plasma or PRP from the patient and stem cells, can rejuvenate youthful tissue again, restores tissues that's been damaged, improve texture in the skin, provide volume, and it's one of the most natural ways to do it. Staying on the subject of fat, the other number 4 on my list would be fat reduction. So fat reduction involves either an invasive or non-invasive procedure. There's new technology using radio frequency that can actually break down fat cells through the skin. We can do that with injections of a substance called Kybella, or by using Vanquish or the Exilus technologies, you can pass something over the skin that goes underneath and breaks down the fat cells to reduce excess fat, and then we just metabolize that fat. Or we do it with a ultrasonic device called the Vaser, which is put in through a small incision in the skin to remove fat selectively, but that can restore contour, and we still encourage patients to be working out and dieting properly. And the final thing on my list would be a surgical procedure, and that's any aesthetic surgery procedure. Many people think that surgery will change the way you look, not when it's done properly. So an aesthetic procedure, one done well, should not be noticeable by anyone. Its purpose is to restore natural, youthful characteristics that are consistent with the patient's age, sex, or ethnicity. So an aesthetic procedure, surgery done properly, shouldn't be noticed by anyone because it's a restorative procedure, not to distort, but to enhance youthfulness and improve appearance. So when it's done well, that would be the way it should look. And I think once people understand that and they put a program together that's balanced, they can come out with a very confident improvement in their self-esteem and the quality of their life.